Up next, the Cannabis Reporter Radio Show with Snowden Bishop. After this message.
Evergreens calling.
Are you getting enough CBD each day? Hemp Meds carries the most trusted CBD oil brands like Real Scientific Hemp Oil and Dixie Botanicals to make it easy to add cannabinoids like CBD to your diet. We hold all our hemp oil products to our rigorous triple lab tested standard to ensure that you and your family receive only the highest quality and most reliable CBD products. Hemp Meds is your trusted source for CBD. Visit hempmeds.com to get our premium CBD oil today. Use discount code CBD20 to get 20% off your first order. And now, broadcasting on StarWorldWideNetworks.com. It's time for the Cannabis Reporter Radio Show with Snowden Bishop. Listen in as Snowden interviews cannabis industry pioneers, marijuana experts, policymakers, medical practitioners, patients, and other amazing individuals with compelling stories to share. It all happens right now. Here's the Cannabis Reporter, Snowden Bishop.
Evergreen is calling.
Hi, and welcome back to the Cannabis Reporter Radio Show. I'm your host, Snowden Bishop, and excited about today's show. We're going to talk about pain today. Nearly every debilitating illness or injury has that one symptom in common. Even if it's not caused by something serious, pain itself can be debilitating. There are hundreds of over-the-counter products and opiates that alleviate pain, but they seldom address the underlying conditions that cause it. When the pain returns, we reach for more medicine for temporary relief. And when it returns again, and usually it does, we reach for even more. It's a vicious cycle. What most people don't know is that prolonged use of any pain medicine can cause serious health consequences. Last month, we learned from Dr. Stephen Korn that even common over-the-counter drugs like aspirin and acetaminophen can cause serious problems with the liver and kidneys over time. Furthermore, prescription painkillers are literally killing people every single day. In fact, we now know just how dangerous and addictive they are. What we're beginning to understand about cannabis is that not only does it alleviate pain, it also helps to address some of the underlying conditions. A 2010 study at the IRCCS Neurological Institute in Italy suggests that activation of the endocannabinoid system could represent a promising therapeutical tool for reducing both the physiological and inflammatory components of migraine headaches. An earlier study conducted by researchers at the University of Georgia found that endocannabinoids serve as a synaptic circuit breaker and regulate multiple physiological and pathological conditions that cause pain. In fact, cannabis can also assist with the regulation of appetite, immune system modulation, inflammation, cancer, epilepsy, and a host of other neurological and autoimmune responses. Other studies have concluded that cannabis can help to curb addiction to painkillers and solve underlying problems like depression, which can also lead to addiction. In short, whether you suffer with chronic pain or just occasional headaches, cannabis may provide safe and effective relief without any of the debilitating consequences of synthetic pain medicine. That's the topic of today's show, and I'm excited to bring on our guest who knows a lot about this topic. But first, Dr. Brian Donner has our Medical Marijuana Minute. What do you have for us today, Dr. Donner?
Thank you, Snowden. Today, I wanted to speak briefly about the opiate epidemic in our country and its relation to medical cannabis. This topic is something that hits home for me personally and one that should get even more attention than it already does. I've said it before. As an attending emergency physician, I can definitively say that I can't go through one single shift without seeing a patient who was brought in because of an opiate overdose. Week in and week out, I come face to face with people in their lives which are devastated or lost because of opiates. With more than 200,000 lives lost to opiates in this century alone, we have reached a critical mass and have no choice but to pursue less dangerous treatment options to managing pain. Right now, unfortunately, as a society, we do not have an answer for this ongoing epidemic. However, from evidence that is already starting to build, medical cannabis may be a realistic and viable alternative. Not only is medical marijuana proving to be effective in treating a wide range of chronic pain and inflammatory conditions, There is also mounting evidence that it can help reduce the symptoms associated with opiate withdrawal. Our society is desperate for a safe and effective alternative to pain management and to stop the opiate epidemic and the lives that are being lost. Medical cannabis may be part of the solution to this problem, and it needs to absolutely be explored further. With more education and research on the horizon, I am hopeful that medical practitioners will begin to integrate medical marijuana as an alternative treatment option for patients suffering with chronic pain and opiate addiction. I'm Dr. Brian Donner for the Cannabis Reporter. I'll be back again next week with another Medical Marijuana Minute. Back to you, Snowden.
Thank you so much, Dr. Donner. With that, let's get started. So we have a returning guest today who first appeared on our show last year with NFL champion Marvin Washington to discuss cannabis as an alternative therapy for football players. Dr. David Tonkin is a board-certified anesthesiologist with specialties in pain management, addiction, and minimally invasive spine surgery. He's also one of the few physicians who actively advocates for medical marijuana as a safe and effective alternative for treating pain. Welcome back, Dr. Tonkins. I'm so happy you could come back to us today.
It is good to talk to you. I haven't seen you for, 2 or 3 months now.
Yeah, it's been a while. I'm just so grateful that you could come and talk to us about this today because it is such an important topic, and we've touched on it over the months, but we really haven't dedicated an entire episode to pain. And I know that this is your area of expertise, and so before I start asking you and drilling you on pain management with cannabis, for those who haven't heard your first interview with us, just explain a little bit about how you became interested in cannabis as an alternative to treating pain.
I actually have a couple pain clinics around the country, and my wife and I were wondering if there's actually any legitimacy to medical marijuana in treating pain. Being brought up in Pennsylvania, a small town, we always, had marijuana was bad and bad people would use marijuana and things like that. And trying to get over the stigma of medical marijuana was tough. But once we started looking into all the research that's been done with medical marijuana, it's pretty impressive. It actually does work for pain. So I'm actually in Springfield, Missouri this week. Last week I was in our Myrtle Beach location. Unfortunately, there's no medical marijuana in the states of Missouri or South Carolina, so we are unable to recommend it in those states. But we started looking at all the research, and it was compelling. And states that we have clinics in that medical marijuana is not allowed or legal, we started using CBD, and CBD has done wonders for our patients. They're actually closing one of my clinics right now, cleaning up, but I could go grab one of the nurses. There was a young lady that came in today that had Parkinson's. She was fairly young and advanced Parkinson's. She could not even stand still or hold anything, or even a cup of coffee, because it was just spilling all over the place. So we gave her CBD sublingually, and I had her, she was a new patient, told her exactly what we were doing, and had her sit in a room for 20 minutes. And we kept on walking by the room and peeking in, and in 20 minutes she was standing there still as you or I, could do, and no tremor at all. And the nurses and the patient were just dumbfounded that she's on all these medications for Parkinson's, and actually one dose of CBD, and she was calm as you or I. So we started using this, about last summer, using it for pain, and we started doing some in-office clinical work and seeing if it actually worked. We told the patients what it was. The CBD we were using didn't actually have any THC in it at all because it's illegal in these states. And we started monitoring if they were able to reduce the amount of opioids they were using. And we were talking people with some severe pain. A lot of patients, we broke them up into 3 groups. 2 of them were actually pain groups. One was patients that had back surgery. The other ones were people that have fibromyalgia. And they were able to decrease their amount of opioids they're using up to 60% in 1 month. The other thing is we also gave, I know you were talking about, or Dr. Donner was speaking about addiction and cravings and treatments for opioid use disorder, and we gave, the last group was a group that takes Suboxone, a buprenorphine-containing product used for opioid and heroin addiction. And we gave the 10 patients in 1 week. 4 of the patients returned all their Suboxone, said they didn't need anything but the CBD. So in those states, we're using CBD. In the other states, it's compelling that, the medical marijuana actually helps with pain. The decrease in the deaths is anywhere from 25 to 30%, where there's legalized dispensing of medical marijuana. So, and the research continues, which is a good thing.
Right. Well, it's fascinating to me that this is just using CBD without any THC, that you're seeing such astonishing results, really.
Absolutely. And we are actually, I think we have 4 clinics opening up in the next 6 months around the country, and those clinics that have medical marijuana, we most likely will be given the recommendation cards for the medical marijuana. There are a couple negative things with medical marijuana. People are being treated for being addicted to the marijuana or trying to get off of the marijuana, but the overwhelming evidence so far is that it's great for pain, that there's much less deaths, and also, if in states there are medical marijuana dispensaries, the actual illegal drug dealers, they're kind of causing a problem because they're mixing their marijuana you buy off the street with medications and substances that are killing people, just trying to compete with the legalized dispensaries. So there are a couple negative things about it, but using pain, it works very, very well. For the addiction, it's conflicting scientific evidence. The CBD actually helps with the cravings. Even a single dose can decrease your cravings for up to 2 weeks. The thing they're trying to debate right now is the THC part of it, because it seems like the THC part of medical marijuana actually works on a reward system, which may encourage legal drug use and things like that. So using it for addiction, I think it's we're still investigating that. But I know the CBD actually decreases the cravings and things, so, and the withdrawal symptoms. We sometimes use it here when we're inducing people with Suboxone to bridge them in between the periods when they last used the heroin or the opioids and the time that we can induce them. When you induce someone with Suboxone, they have to be in moderate amount of withdrawal, and a lot of addicts, that's what they're scared of, is going into withdrawal. So if we're able to alleviate a lot of the cravings and the side effects of the withdrawal, the patients are more likely to go on with the therapy and initiate the therapy. So it's been very beneficial to us.
Yeah, in one of the recent shows, Dr. Berman was talking about the treatment centers and how a lot of people who are coming off of hardcore addiction to heroin or other opiates, and they're in a treatment center, they're not allowed to have any kind of psychotropic chemical, if you will, in their body at all during their treatment time. Otherwise, it invalidates their insurance and a host of other problems. But what she was finding in working with addicts was sort of interesting, that essentially they respond really well. If they're very going through serious withdrawals, the THC actually
calms them down. Yeah.
Yeah, really alleviated some of those terrible symptoms that they were having. So it was just very interesting. But because the nature of treatment and whether or not it's covered by insurance, they were having a problem with even introducing that as an alternative for those people. Do you think that that's going to be an issue moving forward, and is that something that you've had to deal with as well in Missouri?
We haven't, because there is no legalized marijuana in Missouri.
Mm-hmm.
I'll tell you, I was just 2 or 3 weeks ago, I was down at the NBA All-Star Game in New Orleans, and I was talking to a friend named Jason Williams. He played for the Nets and played in the NBA for quite some time. He actually has a rehabilitation center down in Florida that has 200 beds. Then another one, it has, I believe, 10 beds. And he is going to start using CBD actually in his rehab facilities for exactly what you're talking about. I can see some benefit of using medical marijuana in that acute stage when they start getting off and going through the withdrawal and the detoxification, the acute stage. But our goal, in medicine is to get them off everything.
Right.
And including medical marijuana and CBD or Suboxone, our goal is to get them off everything. And, part of the treatment is behavioral health. So getting psychological care and ways to deal with the pressure that use drugs and get them out of the environment and all that kind of good stuff is our goal. So our goal is to get them off everything and get them back to a productive life and being a productive parent and, citizen out in society. But acutely, there probably is some benefits to using medical marijuana just for the withdrawal to get them through that acute phase that is the toughest. And then with therapy and other modalities, let's get these people back to being productive people.
Yeah, and then moving on to pain, because, a lot of the addiction that we see in this country starts with treatment for pain, conventional treatment of pain with opiate painkillers. And, even with aspirin and Tylenol and Advil and all of that. It seems that pain is just such an incredibly debilitating problem to begin with, and then couple that with the addiction on top of it. But you've had some success with treating pain with CBD. Is that right?
Absolutely. It works wonderfully. Acutely, when the patients are asking about stuff, usually we give them about 25 milligrams, and they can really, really show a difference in their pain levels and things. You're right. In the NFL, as you know, Marvin and my friend Josh Kinney, who played in one World Series with the Cardinals and stuff, they're, other than opioids, they use Toradol a lot in their locker room, and that just kills your kidneys.
Yeah.
Everybody's always just, worried about all the professional athletes and opioids. Actually, the NSAIDs and the family of NSAIDs is really causing havoc on these professional players. So giving them an alternative, and if, the NBA, the NFL, and everything's worried about the THC component of it, actually being able to give something that's non-psychotropic like CBD, non-habit-forming, addicting, or the biggest thing that, with all these overdoses is the respiratory depression that you have with opioids. And when you mix them with benzodiazepines, medicines like Xanax, Klonopin, Ativan, things like that, that's the deadly combination there. So being able to offer a supplement, right now I guess it's called a supplement, we'll see here in the near future, but that won't decrease your respirations is vital for the safety, and the welfare of the patients out there. So there are alternatives out there. We just need to get the education and the research in front of the right people so our patients can benefit.
Yeah, and how is that going, by the way? I know that the last time I spoke with Marvin, he was really actively seeking to go to the NFL and raise this issue. Do you have any follow-up on that?
I spoke to Marvin this past weekend. I know they're doing a huge research up to Harvard University. I haven't heard anything else. Believe it or not, I might be talking to Marvin tonight, and I'll make sure I get that information in email or call you directly. But I'm hoping so. And here's the thing that Marvin and I preach to everybody. It's so publicized that these professional athletes, and there's thousands of them that have CTE, for concussions and all these pain issues and opioid addictions. But what people fail to realize is we have hundreds of thousands of high school athletes, hundreds of thousands of college athletes that have had the same trauma to their brain with CTE or have been started on opioids or anti-inflammatories that have been continued to take these. So even though the professional athletes get all the spotlight on them, we literally have millions of people out there that are addicted to these medications that were started short-term and ended up being chronically used for years. And it's other than destroying their health, it's destroying these people's lives and their families' lives.
Right. And with brain injuries like CTE and other traumatic brain injuries, the opiate addiction can actually exacerbate the degenerative nature of the problem, correct?
Absolutely. Other than, neurologically, people fail to realize that opioids affect so much of your body. They affect the neuroendocrine system. Your hormone levels are usually off, and your doctor should be checking your hormone levels every 3 to 6 months to see if they're affecting them. So it's just not the psychotropic effects, it's physiologically effects that opioids are, influencing or interrupting, and no one really ever talked about those things. But there's no long-term studies ever in the whole world that ever showed that long-term use of opioids is something, beneficial. There's other alternatives. We always try to find out what the underlying pathology is to their pain and then fix it without anything. With, if they need surgery, they need physical therapy, they need interventions like injections or procedures. But last thing is to start opioids. But the problem is, for years and years and years, doctors have been prescribing. As you know, when I talk to you, is these family doctors or even specialists, they have 5 or 6 minutes to see the patient, and the number one reason people go to the emergency rooms or the doctor is because of pain.
Right.
And the doctor's trying to take care of their high blood pressure, diabetes, their stroke, everything else, and the pain person just says, I hurt more, and they keep on elevating, and in 10 seconds write a script for their pain medicines and then start directing their attention to their other comorbidities. So over the years, these people never get help. The milligrams of morphine or whatever they're taking goes up, and then before you know it, you have a problem. And then the doctor says, I don't feel comfortable writing for these medications anymore. The patient has a problem, and the patient's in a situation, they're back against the wall, and a lot of times there's no one to help them, where, my company tries to help them with all that. But there are so many alternatives out there other than opioids, and they should be our last straw when absolutely everything else has failed.
Yeah, and it's funny because the opiate addiction doesn't carry with it the same kind of stigma as just even moderate marijuana use, for example, or addiction to heroin, and it's very, very common.
Yeah.
I mean, more common than anybody really cares to admit.
Yeah, they say this is like 2014. Statistics that 3,900 people start non-medical use of prescription opioids daily.
Yeah.
580 people every day start heroin use, and people that start heroin use were 4 out of 5 people. They started using painkillers. That's how they kind of got to that. Where 10 years ago it was like 1 out of 5. So I think, I always tell everybody 80% of the problem of this opioid epidemic is the physicians. The physicians have to have the backbone to say enough's enough and stop this silly, trying to make everybody happy and your patient happy because you're worried about their Prescani scores or their satisfaction scores.
Yeah.
You need to put a stop to it and get them help. And I think it needs to be a four-pronged approach to solving this problem. Number one, the biggest problem is the physician. Number two is we have to have law enforcement working with the physicians. And the third part of it is the pharmacy. So the pharmacies need to stop just questioning these doctors what they're doing and quit just putting as much medicine as the doctor writes in the bag. They need to call up and see if there's actual real pathology or real reasons the patients need medications at all, opioids, or the amount they're using. So the pharmacies need to start being police officers too, or using some surveillance techniques. The last thing is, by the time the patient has a problem, they're not the ones going to stand up and say, I got a problem, but the families and or the patient needs to speak up and say, hey, I think this is getting crazy, Doc. Mom has got a problem here. We need to do something. So I think of all 4 of us, but number one, the physician is the gatekeeper. He's got to stop doing this crazy stuff, and hopefully law enforcement, they're starting to crack down on this and arresting doctors and putting them in jail for over-prescribing or no justification for prescribing.
Yeah, and, I think that education will help in that regard as well, but, something else that I find really curious as to why physicians don't actually go more for the underlying cause of the pain as opposed to just putting a Band-Aid on the pain. Traditionally.
Absolutely. And I'll tell you, some of the states are really good. The state of Missouri, and I hope I don't have the state of Missouri after me, but I believe they make some poor decisions. They have no problem paying for an opioid that can kill you or destroy a family, but at the same time, patient, it's ridiculous. They can't go get help. You know, I'm 49 years old and out of shape. The official word is deconditioned. Most of our patients are deconditioned, and with some exercise and the right physical therapy, they wouldn't need to be taking anything. But the state of Missouri, like Medicaid specifically, refuses to pay for physical therapy, but they'll pay, hundreds of dollars for an opioid to just put the bandage on it.
Right.
So, and a lot of people that say they're pain doctors have absolutely no training in pain. I'm a board-certified anesthesiologist, and we were very limited on how we knew how to treat pain when I was in residency. Everything was an epidural steroid injection. Well, that doesn't solve many things at all. But actually getting them to a facility where a board-certified, fellowship-trained pain physician can evaluate the patient and make a multidisciplinary approach to fix the problem without prescribing any kind of narcotic is the goal. And I hopefully some of the states like Tennessee, if you're taking over a certain limit of medication, the state requires you to go see a board-certified pain doctor every year to justify what the family doctor is writing. So I hope that the government will put some money in and get these patients some help without using opioids.
Yeah, or at least present them with some other alternatives.
Absolutely.
And hopefully regulation will catch up with patient demand and the demand of doctors like you who actually know the truth of how this works.
I have a question for you, Stone, and you might be able to, because you get to deal with this every single day. So I know the U.S. government, they're going back and forth and getting conflicting statements out of the government, whether they're going to consider medical marijuana, recreational marijuana legal. But I've never heard, but have you ever heard of a doctor that actually gives a recommendation for medical marijuana being arrested or sanctioned? Because it's still a federal offense for a doctor to write for medical marijuana. But have you ever heard of a doctor being disciplined for writing medical marijuana?
I've heard about it, but I couldn't put my finger on it. I know that by law they're not allowed to prescribe because the word prescribe has a very specific meaning. It means that you are, prescribing something that has to be purchased at a pharmacy, and there's usually a specific dose and that sort of thing. But what I do know and understand from Colorado and all of the other states where medical marijuana is legalized, you have to have a recommendation, not in Colorado anymore where adult use is legalized, but when they started out with their medical program and in almost every other state that has a robust medical marijuana program, what my understanding is that doctors need, a patient must be seen by a doctor who makes a recommendation, and that is written into the state law. And I know that for Arizona, for example, in order to become licensed to purchase medical marijuana, you must first be seen by a doctor. And if it were illegal, which it is federally for a doctor to prescribe it, if it were illegal for a doctor to recommend it, then the very nature of that program would put the doctors in jeopardy of violating their own Fifth Amendment rights.
Yeah.
It's like a self-incriminating thing. And I think that there are a number of physicians out there who are still afraid of that happening because the law is very explicit. But, when you're in a state where it's required that you have a recommendation from a physician before you can even become licensed to purchase medical marijuana, certainly the doctors for making that recommendation wouldn't be arrested by anyone in the state. Now, with the current political climate and the change of administration, it seems like the stance on cannabis is going to be a lot more rigid. So the jury's still out on whether or not they're really going to act on what has been verbalized, which is they're going to start going after states that have legal marijuana. And I really don't know what that means, and it's a little bit scary for those in the industry and for those who depend upon medical cannabis for their healing. But, I think that making a recommendation is not going to put a doctor in jeopardy at this point because it's just a recommendation. It's not like literally prescribing them a dose. It's recommending that a patient seek out something other than what they can provide.
We're going to have to work together and start educating not just the public, but the doctors, because you have a great forum.
Thank you. It's a good forum for sure. I mean, and just by nature of being an editor of a cannabis publication, I hear about things a lot, and I'm a voracious reader. When I hear of something that doesn't sound right, or if it sounds like it's an injustice or whatever, I'll research it. I'll stay up 13 hours after my bedtime just to know all of the facts. So I think that with what we're doing right now, educating people who are on the fence about cannabis or skeptical or just unaware is really the best thing that we can do at this point, because, like I said, eventually the federal law is going to have to catch up with patient demand. I mean, it really is going to have to do that. We've got a major system in our body that is seldom addressed in medical school. In fact, you're the first person who told me that the endocannabinoid system was not even covered when you went to medical school. They didn't even mention it.
Nothing.
Yeah.
Absolutely nothing.
And I think it's changed a little bit. Another sort of informal study was done where, just by a telephone bank calling up and talking to medical school administrators and admissions personnel to find out if there's a specialty in the endocannabinoid system. And all but 13% said, what is that? And then of those 13%, they knew what it was, but they said there are no courses on specifically that. In fact, there may be only a couple of mentions of the word cannabis in any course whatsoever throughout medical school. And it's just astonishing to me.
Absolutely. Yeah, hopefully things will be changing here quickly.
I hope so, because there are so many people who can be helped. I actually got a call today from Dr. Naz Dadal, who is a concierge doctor here in Phoenix. And he called me to just say how amazing the revelations are for people who are just complete skeptics. And in very vague terms, without divulging any identities, he told me that he had a 94-year-old patient who was in terrible pain, chronic pain. She'd been suffering immensely for quite some time, and her daughter was extremely worried because the pain was making her so depressed. She wasn't eating, she wasn't sleeping, she was just in constant pain. But apparently she was a school teacher, and back in the 1950s, one of her students was completely flipping out for some reason, and he was very erratic, and he said that he was having a trip of some sort, and he said that he had taken some marijuana, and so from that point forward, she was an absolute skeptic and vehemently opposed to any kind of medical marijuana or marijuana regulation. And so she called the doctor and said, "Can you please just go and talk to my mother and tell her that nothing horrible is going to happen to her, because I really think this is going to help her." And so he did. He went and he had a conversation with her, and she was very skeptical, and he showed her some research and said, "Look, this is not going to hurt you. We can just start on CBD. It's not even going to give you any kind of psychological effect at all." And she tried it, and sure enough, her pain diminished. And she went from, never getting dressed or putting any makeup on to suddenly being social again with, hair done, makeup on, fully dressed and going out with the girls at the age of 92. So when you see that kind of miraculous healing take place, you realize this is a quality of life issue, even as much as it is a medical issue. And I think that the work that you're doing in getting out there and speaking to people, because you do a lot of speaking at conferences, and advocating for certain groups that really could benefit from medical marijuana, such as the NFL players and the Major League Baseball players and others out there, and then of course dealing with your own patients in pain. we need more people like you out there advocating for this movement, for sure.
How many medical marijuana doctors do you actually have to give the recommendation to the Phoenix area?
There are a number of clinics here. I'd say maybe like a dozen at the most that are full on certification centers where there are doctors that are on the premises, and then I'm sure that there are a number of other doctors that simply recommend that you go to a certification center. I mean, there's a growing movement here, and the medical community seems to be pretty well informed in general in this area. I mean, I shouldn't say that they all are, but what I have noticed is when I go to events that deal with medical practitioners, I see a growing number of doctors and nurses and healers in general attending these events. So it seems as though the awareness is growing within the medical community. That's just been my observation.
Well, if we have a business director and everything for my company and things like that. If there's a need out in the Phoenix area for a medical marijuana certification center and or pain or addiction center to treat these patients, if there are 1,000 patients out there that pledge that they need help and things like that, I will personally open up a clinic in the Phoenix area. So
if I hear of that, we should continue this discussion, because I think that there is a growing need. What I believe is needed even more is just more education, more airtime in places where people are in homes that listen to programs like this and won't actually go out and seek out information about cannabis. It's just, I think that it's important for it to reach mainstream media as much as possible, and not just the cannabis publications or the cannabis online outlets. It's just very, very important. And I think as more information gets out there into the public eye, the more there's going to be a demand for clinics and that sort of thing in places like Phoenix.
Absolutely. And if people need help, my wife and I are always try to do the right thing and help people. So if there's a need, we will do everything we can to help out in those areas. So if you identify a place, you just tell us, Snowden, and we'll get it for you.
Well, what's pretty interesting, I think, is that there are a lot of people in very, very rural areas that have absolutely zero access to cannabis and zero knowledge about it as well. And those are the places where certification clinics and clinics in general with doctors who are aware of the endocannabinoid system, that's where they're needed, I think, the most, because you also have some retired communities, and I think that the need for elder care to begin embracing cannabis is huge. And my history with my father, too. I think I explained that to you a while back, and he's doing very well, by the way. But it was a journey to get anyone on board with transitioning him off of benzodiazepines and antipsychotics, which were literally killing him, to having a 100% cannabis regimen. The only pharmaceutical medicine he's taking right now is just to keep his blood pressure up, which is what he's been on for the last 20 years. So I think that a lot of people in the elder community, when the aches and pains start and other systems are creating symptoms of pain, cannabis is one thing that is a gentle medication that is not going to have the same side effects as the benzodiazepines and the antipsychotics would.
Absolutely.
So it's all very fascinating, isn't it?
It is.
Yeah.
I'm just ready to help people. That's
Yeah. Well, that's why we're doing this too. It's why I just so enjoy speaking to people like you who are out there also advocating, for the change to happen. And I think with the discovery of the endocannabinoid system, there's so much more to learn about it. But I think with the discovery of it in general, we're starting to see studies come out that not just for pain and not just for hunger or, alleviating some of the side effects of chemotherapy and all of those things and epilepsy and things that cannabis is sort of well known to help. They're finding that, a lot of pharmaceuticals and a lot of different categories can be completely eliminated. I mean, some of these studies coming out of Israel are just astonishing.
Yeah. It's amazing.
Yeah. So I believe it's poised to sort of transform the field of medicine in general. And, hopefully we can get the lobbies out of the policy making so that, clear, sensible reform can happen. And it doesn't mean, that all the states have to go and free the weed.
Exactly.
But at least the people who need it and people whose endocannabinoid systems are deficient, at least that it can be accessible for people.
Absolutely.
Yeah. So what is, aside from all that we've talked about just now, because we've probably got to start wrapping this up here pretty soon, what are some of the most pressing things that you'd like for people who are skeptical, and doctors too? I mean, we have a lot of people of all different professional levels in our audience. What are some of the most pressing things you'd like people to know?
That there's research out there. It's not a bunch of hippies out there making claims. There's tons of research out there. And as you mentioned, Israel is one of the biggest. They've been using medical marijuana and cannabis forever. So there is tons of research out there. The United States is lacking a little bit, but right now I'm talking to two companies about doing some research on pain and opioid use disorder and treating addiction. But we need to look at all the advances, and then I think what we need to do is whether it's a pharmaceutical agent or it's a supplement or something like that, I think we're going to have the biggest problem is the battle we're going to have with the pharmaceutical companies, Big Pharma, because they are going to want to monopolize it or keep it out and keep it illegal so they continue to make billions of dollars on their pharmaceutical drugs. So I think that's our biggest next step is just getting the research and educating the public and the physicians, and then our battle with Big Pharma.
Yeah, I saw a study, actually today it was publicized for the first time. We actually put it up on our website too. But there was a study done in Mexico. Dr. Sal Garza Mendoza, I believe his name is. He conducted a study with children and the efficacy of cannabis in treating childhood epilepsy. And I put that study side by side with another one that was done several years ago with Pedialex, which is a childhood epilepsy drug that's a synthetic cannabinoid medicine. And the results, when you put those two studies side by side, were completely astonishing. And especially when you start to look at the side effects and you compare those side by side. And for the CBD, there was absolutely zero side effect that was adverse. And for the Pedialex, 33% of them experienced severe side effects. And there was even a death in the study that had 100 children. And 1 out of 100 children died on a Pedialex. It's astonishing to look at it. And then to look at the difference in numbers between those who actually reduced their seizures, the frequency of seizures, and those who actually eliminated seizures using CBD compared with those who reduced or eliminated seizures using a synthetic version of a CBD. And that's a top-selling epilepsy medicine that's used on way too many children, and yet pharmaceuticals do not want to, give way for a natural substance because they're not going to make any money on something that's just a plant, really. But have you worked with any of the synthetic CBD medicines like Sativex or Marinol or any of those? Have you had experience with those in your practice?
Actually, my father has stage 4 cancer, and he always would tell, when am I getting the medical marijuana? When am I getting the Marinol and things for hunger and things like that? So I'm not real familiar with those. I know what they are, but we do have a couple patients here, HIV or AIDS patients. A lot of times will be given Marinol for their appetite, so we do have a couple of patients on it. I personally don't know of any side effects they're having from that, but anything synthetic, anything you're putting, that a lab is making, there has to be side effects to it. And 20 years from now, you'll be watching television, there'll be an attorney up there and saying, if you've been using this and you developed this. So, anytime we keep things natural and not make something in a lab, it's got to be beneficial. It's just common sense.
Yeah. And what's the temperature in Missouri in terms of the political climate?
Oh, it's coming up for vote this fall, I believe.
Right.
They were short last year on the number of votes that put it on the ballot. A lot of the patients that come in and see me, we have from every lifestyle. We have attorneys, we have unemployed, disabled people, we have school teachers, and people are talking about, that they want the medical marijuana. The thing is, are they registered to vote, and are they going to go out and do it, or are they just going to talk? So they need to, if they want to change, they're going to have to act on it.
See, we're actually looking for places that would like to pick up this show in Missouri as well, because anywhere where there's a vote coming up, it's just so important for people to know and understand what this movement is all about, and it's not just for hippies anymore. It's
South Carolina's coming up for a vote too.
Yeah, I heard about
that. We actually have a marketing and media company too. So if they could help with anything, I'd be more than happy to volunteer my time. I'm on television quite a bit too, so we might be able to work together to get out there and educate the public.
Yeah, and it's so important that people know and understand before they go to the ballot box, because we've seen in a number of states that now have full adult use marijuana regulation. A lot of those places voted no on even medical before people became aware, and as they passed medical laws, I think 8 of them actually, just in this last election season, passed adult use laws and first-time medical laws, and it was really just all about the education. So, I think it's important to get the word out that way. But
connotation along, actually having respected physicians and present it in a professional manner to the public, I think is one of the most important aspects, to it. Instead of going back to, having nothing wrong with being a hippie, but having a hippie out there, promoting it. A lot of that's just a turnoff to the general public. But to actually have medical professionals that have degrees and things, advocating for it. I think, here's, even in the pain world, and we do prescribe opioids in my clinics, but unless you're in that situation, no one understands. And unless you have a loved one that is suffering, people don't understand. But as soon as they see they're in that situation and they can actually see the benefits that medical, cannabis can do for someone, and it impacts their life, that will change them. But it's almost like people have to experience the suffering that people go through before they'll actually open up their eyes and say there's an alternative.
Yeah. And I think that's the case in so many different things. I mean, look at just even this fight over whether or not to, repeal the ACA. People who've never been without insurance couldn't possibly fathom what it's like to be a patient that can't go to the doctor because you either can't afford it, you're not insured, or you can't meet a deductible or whatever. It's so difficult. And likewise with cannabis, if they've never been in that situation to need it, you're so right.
Absolutely.
Yeah. Well, I think that we have a lot of work cut out for us.
Absolutely.
Those of us who are
to help you any way I can.
Advocating.
Yeah.
Yeah. It's such an important movement, and I'm really I'm so touched by the enthusiasm of the people like yourself who are actually really in it to win the fight. And congratulations on all of that, by the way. I mean,
you're the one who's doing it every single day.
Thank you.
Way more than I could ever even imagine doing.
Yeah. Well, I think that it's just one step at a time. And chipping away at the stigma, chipping away at the lack of information that's out there, and it's just like, one word at a time. We just educate people the best we can.
Absolutely.
So, yeah. Well, I no doubt you and I are going to be talking more in the coming future, and I'm really excited to, take a look at some of the studies that are on the forefront and all of that, and feel free to send me anything. But I just got the heads up from our producer, Wendy, that we just have a few minutes left. So
wait to see you again in person.
Yeah, but I am so grateful that you were available for this, and thank you so much for jumping on with us today. This is really great, and I'll see you coming up at a conference or two, I'm sure.
Absolutely.
And I'll definitely post information about you on our website. So time to wrap it up.
You have a wonderful evening. I can't wait to see you again.
Yeah, I can't wait to see you too. So thank you again.
You're welcome.
That's Dr. David Tonkin sharing his insight and knowledge with us today. And if you want to learn more about the work that he's doing, please do visit us online. I'll put information about him on our website. Go to thecannabisreporter.com, click broadcasts, and find today's show. There you'll be able to browse other topics as well. Many thanks to our producer, Wendy West, and the team at Star Worldwide Networks for making us shine. And I'd also like to say thank you so much to Dr. Brian Donner for our Medical Marijuana Minute Update. And I'd also like to express our gratitude for our sponsors, HempMeds.com and Zephyr Labs. Thank you for your support. We couldn't be here without you. And last but not least, thanks to all of you for listening. Tune in next week, same time, same place, for another episode of the Cannabis Reporter Radio Show. Until we meet again, stay safe, stay informed, share what you've learned, and make it a great day.
Evergreen is calling, evergreen is always where I feel fine.
Pure CBD is a new and unique fresh-tasting spray product which delivers an exact measured amount of the highest grade 100% cannabis oil with each spray. Each tube holds a 30-day supply when used as directed. No smoke, no mess. For discreet use, Pure CBD can be used anywhere. Pure CBD from Zephyr Labs.